Hello and welcome. This podcast was conceived in the midst of COVID crisis and when we were all in some type of either a lockdown or quarantine. And the value proposition of this podcast is to highlight professional achievements and to facilitate collaboration amongst colleagues who may be in different stages of their careers. And I sincerely hope that this podcast will facilitate professional growth, be a source of inspiration for trainees, and also be another venue for us to connect professionally and grow collectively. So with that said, today I'm so delighted to welcome our guest, who is a pediatric neurologist and is professor of pediatrics at University of Arkansas Medical Sciences, senior vice president and chief medical officer at Arkansas Children's Hospital, Dr. Greg Sharp. Welcome to the Doc Talk.
Thank you. Good morning.
So let's talk. So Greg, you started your career in pediatric neurology and still have a clinic in epilepsy, seizure disorder, and brain tumors. So you're also a senior hospital leader, and for the benefit of our audience, if someone were interested in the hospital management track, what would you advise them? How could they initiate and transition towards hospital management?
I think the answer to that question really depends on what stage they are in their career. I mean, I never really planned to be a hospital administrator. That was, if you'd asked me 10 years ago, was that something I was interested in or saw myself doing, the answer would have been no. It wasn't in my game plan. I just became more interested in the last few years in some things that I wanted to do with this job, and that's what led me to it. On the other hand, I do talk with younger physicians who do have an interest in administrative roles.
Right.
And my advice really for the younger individual like that is to get a second degree in probably in either hospital administration or an MBA. There are actually MBA programs that are specific for physician leaders. And I would highly recommend that, not only giving you the tools that you need, but also the credentials that helps get the attention of hospital administrators to bring you into their fold, if you will. I think that's very important.
And then obviously MBA gets you you learn the language of finance and management, and that's obviously very important in this day and age.
Absolutely. I still actually have a difficult time looking at a financial spreadsheet. It's not my forte. I tell people all the time, I don't even balance my checkbook anymore. I just look on my phone to see if I still have money.
That's the old-fashioned way.
Yeah,
right?
That's right.
So Greg, let me ask you a rather different and a somewhat of a bold question. So as a senior leader, you have to oversee medical operations side of the hospital. And obviously in doing so, you deal with hundreds of people. And when you're dealing with so many people, it is inevitable that at some point in time with varying viewpoints, there is going to be some form of conflict, which is to be expected. So as a leader, how do you make conflict a positive force of change in an institution?
I think you have to challenge the individual involved to look in the mirror, look at their own role, because if there are two things really that come up. One is just behavior that may or may not necessarily result in conflict. And sometimes there's conflict between two or more individuals. I think we have to first examine what the background is, what the etiology of the conflict is,
right.
what biases may be involved, and ask the individual to look at their own role in that. If you have two people in conflict and they've both got a finger pointed at the other, and take no ownership for any part of it, then I find that maybe we need to actually come back and talk about this another day because they're not there yet. But I think it's also important to look at what kind of positive results can come from you can have from this type of approach. I mean, you can have two individuals who maybe have never really worked well together, and then a conflict arises. And that actually presents an opportunity for one to see the other's viewpoint.
Right.
And perhaps actually come out of that a better place than they were even going into it. That would be the goal.
Yeah, no, that's definitely a very unique viewpoint to solve and deal with conflicts in a constructive way. So, one of the things that has struck with me about you is your ability to share life lessons and telling a story. So I remember almost maybe 2-3 years back or so in one of the faculty meetings in the context of overcoming struggles and having a very clear mindset, you told the story quote of a kid from a small town in Arkansas who wanted to become a family doctor and worked hard and eventually became pediatric neurologist and CMO of Arkansas Children's Hospital. So earlier this year, at one of the Candor meetings, you shared your story of a patient safety experience and how it impacted your clinical practice. So I think in my mindset, the storytelling is a great leadership skill that gets the message across, and above all, that message sticks. I mean, it has definitely stuck with me. So within this context, could you tell us a story about an inspirational story from your professional career that may have had an impact in your career trajectory?
Yeah, I am a storyteller. In fact, and
you certainly are.
And one of the downsides of that is that sometimes people are forced to hear my same story over and over again because I obviously sometimes I forget, well, who did I tell that story to? and they go, yeah, I've already heard that one. There are a lot of stories that I could tell that have changed my course. One of the things that I would say that probably a lot of people don't know this, but when I was a senior medical student, my first 2 children were born and they were very premature. And actually, they were cared for at University Hospital by Dr. Arrington, was the attending, of course.
Oh, okay.
And but they were too premature, and this was before surfactant time.
Right.
Okay. And so one baby died on the day of birth, and one lived 7 days. And that was 30-something years ago now.
Wow.
All right.
Yeah, that's hard.
But it gave me a completely different look at a parent's feelings when they have a sick child or they lose a child. Now, I would also imagine that this would become much harder the older the child gets and the more life experience you've had with that child. But it's a tremendous thing, and actually, it's quite possible I might have chosen neonatology, but I didn't think I could at the time. I just didn't think I could do that because of my own experience. I thought it would be difficult. So I think I do have an element of empathy that came from that.
Absolutely.
that I've stuck with over the years, and I can understand maybe perhaps a little better where people sit sometimes.
Absolutely.
During very trying times. The other thing, I can go on and tell many more stories, but I like humorous stories too.
That is always helpful.
Humorous stories teach me things also. And I had a patient once that I actually followed from the time he was probably 2 years old until he was 21. And when he had Asperger's, so he had that kind of very typical kind of dry, monotone language, but this kind of dry sense of humor that he had.
Right.
And when he was a little kid, whenever his parents would ask him to take his medication, he wouldn't take it unless he got on his play telephone and called Dr. Sharp, and Dr. Sharp told him to take his medication, and then he would take it.
So you were on the speed dial.
Yeah, more or less. When he was about probably 11, 12 years old, he comes to clinic one day and he has something to tell me. And I'm warned about this before I go in the room that I'm gonna call him Tom. That's not his name, but Tom has something to tell you. So his dad had cattle, and I walk in the room and I said, Tom, what's up? I hear you have some news for me. And he said, and he showed me a picture of a calf that he had named Dr. Sharp.
Oh wow, okay.
So in reality, I thought this was one of my highest honors ever, because then the point of that is I meant something to him, right? Funny part of this story is a couple of years later, he's in clinic. He has something new to tell me. And I said, "What is it, Tom?" And he said, "Dr. Sharp had a baby." And I said, "Oh, does that mean I'm a father?" And he said, "No, you're the mother." So, funny story. The end of that story, though, is when I had to transition him to adult medicine, he and the whole family sat in the room and cried.
Yeah, that must be hard. Yeah.
And I think that the learning lesson of that is the opportunity that we have to impact our patients' lives and their families, and especially with those long-lasting relationships, as I'm sure you have as well. You literally become a member of that family.
Absolutely.
And that should be cherished and honored. And to me, that's what this is all about. And I have many families like that I will always remember. I recognize the most that I'm getting old when I see a child and their parent was my patient. So sometimes these things come full circle.
That is absolutely wonderful. I'm so glad you shared. I mean, they are so touching, and they have really lifetime lessons in them. So, Greg, on a slightly different note, I want to talk about institutional culture. So, something that identifies the fabric of its people. I mean, the people who work in the institution. It affects our operation. It determines the institutional destiny. So from a philosophical standpoint, why do you think it is imperative for leadership to maintain and define an institutional culture that adheres to the core values of that institution?
Well, first of all, our institution is all about caring for children. And that is, my number one rule is I'm a simple guy. My number one rule is do what's best for the patient.
Sure.
And if that doesn't necessarily fit with standard protocol, then we have to figure out how to make that happen for the child. Whatever's best for the patient. That is number one. The second thing, the second most important thing, are our staff members, our employees. And it's extremely important as an administrator to remain in touch and in communication with, and I've been a staff member here for almost 30 years.
Right.
And so I feel a part of, and I feel like I can directly relate with staff members on any level. I think it's really important that we focus on, and this is what I see my job as. I mean, my title is CMO, but I really consider myself to be the CFO. Does not stand for financial. I'm far from that. It stands for Chief Facilitating Officer.
Perfect. Yeah.
My role is to help people. If you as a faculty member are happy with your work, glad to come to work every day, and feel like you are successful in what you do, several things will happen. Number one, you will take better care of patients. Number two, you'll be a positive influence on everyone around you, your team members, etc. And number three, you're far more likely to have a long and lasting career by staying at this hospital. And that's what we need you to do. And it serves the patients, it serves the hospital, it serves your team, and it serves yourself. And so it's a win cubed for everyone, if you will.
No, this is absolutely wonderful, and obviously, this sort of gets into the fabric, and everybody gets the vibe of coming back to work and putting their best foot forward for the best of the kids. So, no, that is absolutely wonderful. So, on a slightly different note, let's talk about not work. So, when you have free time, and I hope you do, what do you do for fun? I mean, especially in this age of social distancing.
I'm not a sitter. It'll be a long time before I hop into a rocking chair. I like being active and doing things.
Right.
But I have a log house on the Little Red River in a small town, outside of a small town called Pangburn, Arkansas. And when I drive into Pangburn on a weekend that I go there, my heart rate drops probably 7-8 points. and I enjoy it there. I love to fish. A lot of the locals in town think I'm actually a fishing guide. I've had several say, "You're a fishing guide, right?" And I go, "No, I just like to fish."
Yeah, just a part-time fisher.
And they don't know what I do, and that's fine with me. But that's my downtime. And if I'm not fishing, I build furniture, and I do odds and ends. I always have a project, and that I enjoy that. It's good for me.
I've never fished, but I've always fancied, what fishing is all about. So you've given me something to think about.
We might be able to arrange a trip since I'm apparently at least a part-time fishing
All right,
guy.
there we go. Okay, perfect. So, so as much as we don't want to talk about COVID-19, let's talk about it. This viral RNA has literally affected the human DNA for all those reasons, and it has changed our lives and forced us to think and find a new norm for ourselves. So from your leadership position, what are the top 3 challenges that a hospital in general faces today in this context of COVID-19?
I think number one, obviously we have a financial challenge right now. I mean, we have lost volumes, and that was necessary. It's important for us to recover. I think one of the issues there is that people are scared, and as the numbers are now actually going up in Arkansas, we are likely to continue to struggle with that element of fear. And I'll give you an example. I'm on a email listserv with CMOs from Children's Hospital Association. And it was recognized by 2 or 3 of them that they were having increased incidence of ruptured appendixes. So their rate of appendicitis hadn't gone up, but rupture had gone up.
Right.
Okay. And so that, somebody was asking, is this COVID related? And my response was, well, yeah, it's COVID related because people don't want to come to the hospital.
So true. Yeah, they delay
they
care.
sit at home long.
Yeah.
I mean, and you can imagine, I had appendicitis when I was about 13, and I remember that vividly. I mean, that is very extraordinary discomfort. But you wait. You see, maybe the child will get better, et cetera. So there's this delay in getting people to the hospital. I think the second thing is connection with others.
Right. That's critical.
And not only our patients and families, but each other as individuals. I think it's extraordinarily important. I think it's really, really important for us to care about the people that we work with, our team, I think that's how teamwork is really built. I've been in the waiting room when my nurse or my colleague was in labor. I just care about the people that I work with, and I think that's extraordinarily important. And we're in a place where we have to distance more, and we're becoming kings of virtual meetings, right? And so it's I think that presents a challenge for us
as an
institution.
It sure does, yeah.
And then I think the third challenge is this maintenance of care for our patients. Because if they don't come to the hospital or they avoid coming to clinic, et cetera, then that could be deleterious for them. So really important to maintain that contact in whatever form necessary. Right. Even though now we're ramping back up, I think we should continue to try to expand our use of telemedicine that gives us more frequent and direct communication with families. I think we can actually, there's an opportunity there to provide better care. So for instance, if I was going to see one of my seizure patients back in 6 months, I might set up a virtual meeting in 3 months to see how things are going, adjust medications appropriately, et cetera. So I think a challenge could actually be transitioned into a win in that regard.
Right. So, so Greg, your talk of opportunities, that sort of leads on to the next and the last question that I have. So, obviously, this pandemic has negative connotations to it for all the reasons. So going through this experience, I have certainly learned a few things that are, I would say, positive, and I consciously have started to reinforce them to my kids, namely, in life, it's the little things that matter. We should count our blessings every day. And we should learn not to waste things. I mean, I do stress it to my kids. So from your perspective, any silver linings that you would like to share with our audience?
I think life's real joys are simple pleasures.
So true.
Spending time with your family, spending time with your kids and grandkids. I have grandkids now. I mean, there's nothing better than that.
Yeah.
The favorite person in the world for me to have a conversation with is a 5-year-old. I mean, that's really true. That's why I love pediatrics. That's why I went into pediatrics. I mean, they're hilarious. So I have a 6, a 4, and a 5-year-old grandchild and a 1-year-old. But, I mean, what could be more enjoyable than that? So even in this pandemic time, we find ourselves at home, right? And we have that ability. I think probably fathers are playing more with their children, that sort of thing, because there's not anything for them to do. Even teenagers are forced to be at home, which is not typical for them.
Yeah, which is a torture for them.
And that gives us a new opportunity to reconnect. And so I think life's simple pleasures can be accentuated in this time.
Absolutely. No, this is wonderful. So, Dr. Sharp, thank you so much for your time this morning. It has been absolute delight, and I definitely enjoyed talking about all the wonderful experiences and the wisdom that you shared. So this podcast has been a team effort, and my colleague Justin Criddle and I are thankful to all our audience for listening. So please provide us some feedback, and if you haven't already done so, please subscribe. We believe that you will find value in this podcast, which is unique to highlight professional physician careers, valuable life lessons learned, and is another venue for us to connect to each other in this day of social distancing. Until we meet again next time, be well, stay safe.